Good evening, everyone. My name is Dr. Himadri Shankar. I'm a nephrologist from Bhagalpur. So, Bhagalpur is in Bihar, and my hospital name is Ashram Multi Speciality Hospital. Today we'll be talking about chronic kidney disease. Chronic kidney disease, as we all know, is one of the leading causes of morbidity, mortality in all over worldwide as well as in India. And there are almost like 10% of the population of world is affected by this disease. So it is very important for us to know about chronic kidney disease. What is this disease? How to prevent it? Which population to be screened? And further management, how to stop progression. So this is very important to know about the disease. So first I'll be talking what is chronic kidney disease. So basically chronic kidney disease is when the kidney function starts declining. That happens over a period of months to years. So if the kidney function declines, normal, if we assume if the normal function is almost 90, 100, and if it start decreasing, so we classify chronic kidney disease on the basis of glomerular filtration rate. And basically there are 5 stages of kidney disease. So if the GFR, that is glomerular filtration rate, less than 15, we call it as end stage renal disease. And then we have to, if the patient comes under that stage, we have to look for his treatment options, which could be dialysis or a renal transplant. So this is about the classification of chronic kidney disease. And we all know that how do we get to know that a patient, how do we assess kidney function first? So for kidney function, we have to look for a thing called creatinine. Creatinine shows the value, it shows that how well your kidney is working. And a simple urine test that will tell you whether you have any protein leak from the kidneys or there is any blood in the urine. So these all are markers of kidney disease, and we should do the tests regularly in patients who are at risk. So first, talking about the causes of kidney disease. So diabetes and hypertension, these accounts for almost 50% of the cases of CKD. Other causes being hereditary diseases, renal stones, or cystic disease. So taking painkillers, all these can cause kidney disease. So in our country, if we take the most important cause will be diabetes. Diabetes is the first, I think, the first reason for most of the chronic disease all over the world. And whom to identify, like which population should be screened for a kidney disease or CKD. So patient whom to screen, the patients who are diabetics, patient who are hypertensive, patient who have a family history of kidney disease, patient who have recurrent stones or recurrent urine infections. These population are always at risk. So we have to identify those patients, and then we have to take steps to retard the progression of the disease. So, because we know if we take the measures early, we'll get very good results. Like in some cases, there might be 100% recovery as well. If a patient has a stone and we operate it, or timely we take the proper intervention, the patient might get cured, completely cured of the disease. So, and there are certain steps that we should follow for a CKD patient. First of all, if the patient is hypertensive, we should control his blood pressure. The blood pressure goal should be less than 130/80. That should be the standard. And for kidney patients, sometimes it gets difficult to control blood pressure because most of the times, probably he might need 1 or 2 drugs or even three to four drugs to control the BP in a kidney patient. So the dose has to be optimized and everything has to be done properly. So screen diabetics, look for manage proper sugar control has to be done. Proper blood pressure control has to be done. There are certain do's and don'ts for kidney patients. That is very important. First is don't take self medications. There are certain drugs that causes kidney disease like painkillers or certain kind of antibiotics. Even studies have shown that herbal medications they have caused kidney disease in certain parts of our country as well. So we have to be careful about those things also, because we all know it is very important to stop the progression of kidney disease, because once the patient lands up in end stage renal disease, that is GFR less than 15, we don't have much options of treatment other than hemodialysis or a transplant. And to be honest, transplant is the best form of renal therapy. I mean, treatment. That is the treatment. Dialysis per se is a bridge therapy. So the treatment will be transplant. There are certain advices for a CKD patient, that what should he do or what should she do to change or to stop the progression, like certain changes in diet, where diet, the most important fourth or fifth stage, we have to restrict potassium accordingly, and there has to be protein restriction. And protein restriction for a kidney patient would want him to have a protein of around zero point 0.6 to zero point 0.8 gram per kg body weight. Same patient, if the patient lands up in dialysis, will increase his protein intake. Lot of studies, plant proteins are better than animal source of protein. So a plant-based protein diet is always preferred. Second, phosphorus. Phosphorus has to be limited. So dairy products or non-vegetarian diet has to be limited in patients. Other than that, there are certain advices that has to be followed by kidney patients. First, if the patient is a smoker, he should immediately stop smoking. Second will be adequate physical like exercise that has to be done. The recommended schedule, the plan for the patient is like at least 150 minutes of activity over the week. So patient who are having initial stages, they should not live a sedentary lifestyle, because sedentary lifestyle, as we all know, will cause your sugars to rise, will cause your blood pressure to rise. A healthy lifestyle is always preferred for a CKD patient. So you have to have the regular exercise. There is and then the third advice will be, you should have plenty of rest and adequate water. As we all know, as the disease progresses, CKD patients, they might have swelling, they might have edema, that is called you see they are puffed up, they have facial puffiness. So the right amount of water is required. For CKD patients would like to restrict water. Sometimes that depends, that varies from person to person and patient to patient. So if we would like to keep it around 1 or 1.5 liters per day, depending on their physical conditions. Adequate walking is necessary for patients who have chronic kidney disease. Check your weight adequately. Like you have to maintain a proper weight, because sometimes the patient might have weight loss, and that has to be checked. Even so, whenever the patient has chronic weight loss or a weight gain, you should immediately go and consult your doctors. You have to always look for signs and symptoms. Initially in CKD, probably you won't have much symptoms, but as the disease progresses, most of the patients have symptoms like nausea, vomiting, loss of appetite, itching, generalized body swelling. So you should always monitor your symptoms, and that is very important, because the symptoms will guide you for the treatment as well. And there are certain nowadays we are seeing a lot of videos, like there are certain kind of people, they claim that CKD can be cured through herbal medications, through Ayurvedic medications, but that is not a proven science. So always go and check with your nephrologist. So my final advice will be for all the people is that, you should help the doctors to help yourself. I mean, we will guide you, will give you the right kind of advice, but you should trust your doctor, trust your nephrologist, and we'll always guide you and give you the best form of treatment possible. Thank you.